Do you want to get back on your feet without pain? Are you sick and tired of that stabbing sensation in your heel, or your Achilles aching in the morning after your favorite activities? Everyone has or knows someone with a foot problem. We specialize in adhesion release and nerve entrapments that create foot and ankle issues. Are you ready for lasting relief? Book a consult. So today we're going to work the flexor retinaculum in the foot. It's a common spot of irritation in people that have foot or ankle pain or tingling into the heel. So as it goes from the ankle back towards the heel, we want to check this. So go ahead and pull the foot up for me, please. And we're just going to challenge that tissue and see, okay, where is it the most restricted? And that spot is right here. So I'm going to sink down into that space. And go ahead. And then as we move, we feel a lot of motion in there, which allows us to get rid of the adhesion or the damaged tissue. Good. So today we're going to be working plantar fasciitis or adhesion in the foot causing foot pain. What we want to do is use our instrument, and we're going to be sinking into the tissue and feeling where are the restricted tissues. And as we go through this, we can really highlight and enhance exactly where the problem is by altering how much tension we have on the muscle or the fascia and work through it through here. Sometimes we can match this better with the angles of our instrument by sinking right into this space and working that spot. So whenever we have a foot and ankle problem, we can't just address the foot and the ankle because the nerves that go to that area come from up the leg more. So oftentimes people have seen multiple providers and not gotten the relief that they're looking for because they've only had treatment to their foot or only along their ankle. What we need to do is follow the big picture, and what we're going to do today is show where that all starts. So when we want to follow this nerve, the sciatic nerve comes down and splits into the tibial right above the knee. As that continues to go down, it's the tibial nerve that feeds these muscles and eventually comes down into the foot. So we want to find that nerve in this space behind the knee. Then we're just going to challenge so it's stuck right here as it goes through the gastroc and into the leg. This is important. So we're going to sink into this space. Get right up against the nerve, then push the nerve in between the muscle and nerve, and go down. And now we're going to stay in that space as the nerve stretches. This is a little uncomfortable. And we treat this spot, holding our tension, breaking down the adhesion and nerve entrapment. Good. Okay. So there's other muscles that can also have a similar effect on this. So not only with the gastroc or soleus calf, and then we've got the tibialis posterior, which runs deep. That's a really common muscle that will have an issue with this nerve that stabilizes the arch of the foot. So when that is stuck, big problems are going to happen, and your problem won't be fully resolved unless someone figures this out. We've also got the FDL, which runs along the inside of the leg and goes to the toes. So that's an important muscle. And then the FHL, which stands for flexor hallucis longus, that comes from the outside of the leg, crosses near the Achilles. So when we see people with Achilles problems, whether it's a tendinosis or tendinopathy, these muscles need to do their job. And if they're stuck to that Achilles as they cross underneath it, that's another big thing that can create an Achilles problem that needs to be addressed if you want lasting, thorough results. Now we're going to work the plantar fascia and the adhesion in the foot, which is very common and almost always underdiagnosed when it comes to this type of case and pain. So we're going to be using our pressure wave device, which uses sound to break down damaged cells, including adhesion. And here we go.